Welcome to the People and Planet podcast, a show all about human health, planetary health, and the links between them. I'm your host, Ali Al-Hamed, an integrative nutrition health coach with a master's in environmental sustainability. I spent most of my life exploring these topics, and this podcast is my effort to collect and deliver information from experts to improve the quality of your life and that of our planet. Thank you so much for being here. In this episode, I'll be interviewing Dr. Naser Al Nusif, who is a specialist orthopedic surgeon with a background in sports medicine. He is an expert in sports-related injuries and upper extremity surgery, which include injuries to the shoulder, elbow, and wrist. In our conversation, Dr. Naser highlights ways in which we can prevent injury. We'll discuss components to consider for optimal recovery post-surgery, as well as the latest technological advancements in the field. Dr. Naser completed his orthopedic surgery residency at McGill University in Montreal, Canada, and then pursued a fellowship in upper extremity surgery at Western University in Ontario, further enhancing his expertise in this specialized area in one of the top shoulder and elbow fellowships in North America. He then completed a sports medicine and arthroscopy fellowship at the prestigious New England Baptist Hospital, which is affiliated with Tufts University in Boston. During this fellowship, he was involved in the comprehensive care of the Boston Celtics NBA team, as well as did sports coverage for the Merrimack College sports team, gaining invaluable experience in sports-related injuries and treatments. Dr. Naser currently serves as a specialist orthopedic surgeon at Al Razi Hospital in Kuwait and serves as the program director of the Kuwait Orthopedic Surgery Residency Program. He's also stationed at a private clinic in Kuwait called Pod Clinic. This conversation with Dr. Naser is super informative and insightful. I'm confident there is a takeaway for everyone and anyone interested in improving their physical health. Hope you enjoy it. Well, Dr. Naser, thank you so much for being here. It is such a pleasure to speak to an orthopedic surgeon and gain insight into your world and into your expertise. So thank you for taking the time.
Thanks a lot for the invite. I'm really excited for having this interview and podcast, I would say.
Yes, absolutely. Well, I'm just going to jump right in. So what does a day in the life of an orthopedic surgeon look like? And do you have any rituals or routines or practices that you put into place to get you into surgeon mindset or surgeon mode for your day?
So I would say what makes our job a little bit different is that, the two aspects of being with patients or clients, whatever you call it, either in the clinic or in the surgery, or and usually in the surgery days depends on the complexity of the surgery that I have. So, routinely, if I would have a routine, 3 surgeries a day that are simple or straightforward, more or less it will be a simpler day, the day out of the surgery, or a few days ahead of time. We always have to review the patient's, charts, looking at their notes, looking at their images in terms of x-rays, MRIs, or CT scans, so it depends what it is, and have a proper plan. And then usually the night before, I usually like to brainstorm. I have this half an hour time, an hour, depends on the significance or the severity of the case or the surgery, and I just, think and go through the steps, because, surgery, after all, is a procedural thing, something that you have to do, and you have steps that you go through. So that's what I spend usually the night before, thinking about that surgery. What's my plan? What would be better tailored for this patient for the best outcome that I could gain? Then the day of the surgery, usually, we start around 7, between 7 and 7:30, is when I see the patients come in, the first patient for surgery. Those things pass by to us, but to the patients, they matter a lot, because to them, every patient feels that this is the big moment in their life. So although, some don't think about it as much, but I always think of it that I have to make sure prior to the surgery that I see the patient, have a discussion with them, another discussion, or more or less chit chat to make them more chill and less stressed, because, we usually develop a rapport and a relationship before surgery in clinic. And then, usually to me, on my way to the hospital, I just, think of if there is a big surgery that usually requires more preparation and more thoughts and more reading, and sometimes even asking for opinions from colleagues about that. But on the night before, keep thinking about those steps. The day off, on the way, some own prayers in my mind that I always have to say to the way of the hospital to make things easier and simpler for me, hoping that would facilitate the day. So that's usually in a nutshell, between cases, between surgeries, we go through the cases. Usually I have team with me that I have good discussion, whether it's students or residents that are learning. So it's always part of the day and in the routine is that between surgeries, we discuss the cases, what are the images, the technicalities of the surgery. So that, it gives it more of a positive a day for me. Whenever you teach someone, you feel good about a good reward. That's in a nutshell a day, and that's how it goes from the morning until I would say 3-4 p.m.
Yeah, it's really interesting because we all have doctors, right? But we have no idea what's going on behind the scenes, especially when it comes to like surgeons. Like, what are they doing when they're not consulting with us or preparing for our surgery in an appointment with us? So it's like, how do you set yourself up for a successful day, especially if it's a complicated surgery? I know you also have experience with the Boston Celtics NBA team when you were in America. Do you mind unpacking that experience for us? Like, what did you see? What were you doing? How many years did you spend with them or months? Is there anything that the layperson can learn from your experience with these high-performing athletes, these professionals? Is there anything you saw also from a surgeon's perspective in terms of like how they had injuries or how they prepped for surgery or the way that they recovered post-surgery that a layperson can learn from? If you don't mind just sharing a little bit of that, I think that's super interesting.
Yeah, definitely. So it's actually a very interesting part of my life as well, because it was an amazing experience to be part of that. Just to go to a quick, I don't know if you mentioned that before, or it's just the educational process for us as surgeons. After finishing med school, we do 5 years of residency. That's an orthopedic surgery residency program. It's a 5-year program that we learn all different aspects of orthopedic surgery, from pediatric to sport, and all different specialties. After this residency program, the 5 years, we do what's called fellowship, which is a subspecialty in the field of orthopedic surgery. So I've done a year of upper extremity fellowship, and then I've done a year of sports fellowship, and that's when I did it in Boston, the sports fellowship, and it was at the New England Baptist Hospital. And the Boston Celtics team was affiliated with the New England Baptist Hospital. So the team physician that works with the team is part of our faculty that I work with in the during my fellowship. So part of this experience is definitely being with the patients during the game. So we would be during the NBA games, sitting with the players, being in what we call them locker rooms, where the players are sitting between the timeouts and the breaks and sitting there and before the games as well. So it was a great experience being around high-level athletes. Not that it matters or makes a difference between any person or high-level athlete in terms of the treatment, but they're a different niche of a population that, each player is a multi-million cost to the organization. Not that makes a difference to anyone else, but to the organization as a team, they think of them as, athletes that are, they're high potential in terms of performance and games. And so they always want to optimize their care by getting the best practices and best treatment modalities used for them to have the fastest recovery and going back to sports or back to the field. So that the great experience that I had is, whenever any of them had injuries, or even the other team in the court would be injured, we have to go and check on the players back in the medical room during the game, which taught me a lot as an experience, because you have to make fast decisions, fast assessment, and at high stakes. If you tell the player that you do not continue this game, it makes a huge difference to the team, to the player himself as well. So that was a great experience. And also behind, after the games, that when they come to the clinics of that surgeon that I work with, we're always assessing those players, making a treatment plan. So just for me, it was a great experience
Is there anything you could share in terms of their recovery? You were saying that it's such high stakes, they need to recover fast. So is there anything you could share about, optimal recovery and suboptimal recovery, whether they have or need a surgical intervention, or it's a sprained ankle and it doesn't need a surgical intervention? What are some of the things that we can learn about having the best recovery possible from an injury or from an injury that required a surgery, so then after a surgery?
That's a great question, Halia, really, because, a lot of the times people come in, whether they require surgery or not, they only listen to that main categories. I don't need surgery, good. I need surgery, I'll do the surgery and then we'll see what happens. The biggest part of having a good outcome, whether it's surgical or non-surgical, is having all the different parameters around that person or patient or player or any individual who's having this injury. And those different parameters that I learned that they optimize in the Boston Celtics, which is applicable to every single person, but people care about those different aspects differently and pursue better outcome differently, or they get the message differently as well from surgeons or physio. Is that in this team, the first and most important thing that I would mention is that it's a multidisciplinary management plan. So first of all, you get seen by the surgeon, the orthopedic surgeon who specializes in this field, that gives you the proper diagnosis, which is the first step. Once you get the diagnosis, then after that, you get your treatment plan. Whether the treatment plan is in broad categories, surgery, whether it's physiotherapy, whether it's an injection, all those modalities, or any rehab process, at least you define them in broad, because you don't want to miss an injury that requires surgery, and you don't want to ignore an injury that requires physiotherapy. Then once you assign that person to the physiotherapist, in those sports or high-level athletes, there are different members of that team or the rehab team, including an athletic trainer. So the athletic trainer, or they call them ATs over there, is that a person who is a connection between the orthopedic surgeon and the physiotherapist, is the person who gets the whole treatment plan until recovery and return to sport, and gets the treatment plan to the physiotherapist. And then there's a physiotherapist who working and depends on what modalities that individual needs or the injured person needs, whether it's stretching, whether it's strengthening, whether it's pain modalities, whether it's machine, cryotherapy, dry needling, all those. It's a whole different specialty that I'm not even a specialized physiotherapist to even know what are the details, because that's their own specialty that they work on. And then that in the middle of all that comes a nutrition as well, as there are nutritionists that are specialized in those sports teams that take care of the diet of those players, and going from their meals, their snacks, how to optimize their health throughout the process of recovery and during their season as well. And to add to that, it's something that honestly I've never knew about it in Kuwait, not even know about it until I reached that fellowship. When I saw that team, is that they have even a psychologist in the team that works in optimizing the mentality of those players and get them in the game in terms of the rehab process to get the best, how do I call it, the best feeling or the best vibe during the day, and how do they get in the physio process. And so even when they want to come back to sport, they get them in the game, because those players, especially NBA players, they spend every other day they play. So if they're out for 6 weeks or 2 months, it's big to them to be back after 2 months. So getting them in the game is also part of it. So all those aspects key in to get the best outcome in both different options.
I love that you brought up the topic of psychology, because I really do understand how a person's psyche and their mindset can either upregulate or downregulate genes that are responsible for healing. When we're feeling really anxious or depressed, we actually can, increase inflammation. So you're talking about the psychologists that are helping these professional athletes to get back in the game. But I have a feeling you're also alluding to these psychologists helping these players get into a positive mindset about their recovery and about their injury, even if they're not playing, they're just in recovery mode. So I know I know when we first met, you were talking about with your colleagues, and I can't remember if it was you or one of your colleagues talking about how, especially in Kuwait, which is where you practice now, that there's a lot of psychological support that's needed during the injury process or the recovery of surgery, and they don't. These patients don't have the psychological support. So what ends up happening is they emotionally eat and they gain a lot of weight from depression. And so I wonder if they did have, that support, if some of those negative consequences of feeling so, a lack of connection to their favorite sport or a lack of movement, if some of those things would be subsided. Because I know that that's something you spoke about when we were at that conference, when we met a few weeks ago. Is there anything else that you find that's like outside of the physical health realm when it comes to recovery? Things like placebos or visualization or community or anything else that is not, within the realm of physiotherapy and injections, which I'd like to get into a bit more, but that you've noticed that people recover better when they have a sense of community or people to rely on, or are there visualizations or meditations or anything else that's just like outside that conventional realm of recovery?
So just to touch base on your previous point, that's absolutely true in Kuwait. It is a problem that they do not have psychological support. That not even gaining weight is even smoking sometimes. Like some people use their stress, the things that leash out their stress. People go back to smoking and all that, and all the bad habits that would be from that. I'm sorry, we'll close on that, and just going back to your question. So in terms of, meditation or things that people would do, that I think mostly goes in different individuals. So that goes into different habits. They're players, some individuals like to meditate, some individuals like music, as a form of relaxation or getting back to the form. But communities wise, I would say that more in the orthopedic field, not necessarily mostly in sports field, but in a lot of conditions that are uncommon or things that are more complex, they do not have as much of people that they would hear. My cousin had a situation, I can relay my experience to them, but sometimes the case is less common. That there are communities that I've seen in North America, is that in rare cases that if someone has a condition that you do not know what's going to be coming in the future, whether after surgery or after recovery, is that there is a community they can always contact to sit and have a chit chat with, to talk about your condition, about what are the expectations, what did they go through, and that's definitely helpful. And it's an important modality, one of the modalities that are used there to help ease the stress of individuals going through surgeries or any conditions that are uncommon. So when they sit with them, they listen to their feedback and what they've been facing. It definitely easing up their stress and concern. That's in those kinds of patients.
Because emotional stress matters too. And it also is like if we feel so lonely and we don't have anyone to talk to, and we're not releasing some of that stress through the physical activity that we're used to engaging with, I can imagine how helpful community or a sense of community or having just friends around your family can be to someone's recovery. So it's really interesting to talk about that. You mentioned injections. Now, I'm not a professional athlete. I'm very active. I do lots of sports. I go to the gym frequently, and I know a lot of people in my community do as well. And we have come across injections like PRP and cortisone, and I think there are a few others that I'm not aware of. Do you mind walking us through the different types of injections, what they're used for, what are the contraindications or potential side effects, or if there are any negative side effects? If there is anything that the lay person that is active and might have an injury, like I had a ski injury a few years ago, would it would be important for me to learn more about. It's not just about the professional athletes that are looking for this type of treatment, but it's the lay person who's also just active and engaging in sports.
Yeah, absolutely. So I think it's a very important question for everyone, because injections are not purely indicated for players or sports or athletes. It's indicated for every person from younger to older age, but it depends on the indications. So for the most part, most cases that I encounter, or most patients or clients or athletes that I see in clinic do not start with an injection. So I usually, after getting a diagnosis, the first steps would be, depends whether it's medication or physiotherapy as the first step. If that failed, then the next step would be an injection. Obviously, there are definitely some exceptions to this rule, but that's for the most part. Those are the steps that I usually take. So the injections, in broad, if I would divide them into the most common and the oldest in terms of the track record, as we call it, is the cortisone injection. It's an injection that is mixed 1 milliliter of cortisone and then mixed with local anesthetic and injected around the joint or the ligament or tendon. And then the other option or the other category would be the PRP injection, which is platelet rich plasma, which is taking the blood from a person, putting it in a centrifuge machine, and then isolating cells that are anti-inflammatory in a syringe, and then we inject them back to, again, joint, tendon, or ligament. And that basically is the person's own body and is injected back to that part to reduce the inflammation. And then the other category, which is the hyaluronic acid injection, which is a synthetic material which is created by human, and it's basically thought of to be like a gel within the knee that neutralizes or gives nutrition to the joint and reduces the progression or the inflammation, and reduces the joint arthritis, mostly indicated for osteoarthritis, which is the grinding between bones. Those in broad are the most common ones. Now, there are more recent things like stem cell injection, fat cell injection, and those are more into the scientific and more the experimental part. Some people are using it, but there is no good evidence that supports them yet. And it's not being broadly used. It's only in certain places and centers around the world. But when we're talking about the other three main injections that I mentioned, hyaluronic acid, as I mentioned, is mostly indicated for osteoarthritis. When we have bone-on-bone, say, grinding, or even less severe. Then the cortisone injection, along with the PRP injection, are given for tendon problems, ligament problems. And my broad indications usually between those that in a younger person who's more active, and when it involves tendon, I'd like to lean towards PRP injection because it does not cause, let's say, damage to the tissue. A lot of cortisone injection, repeated cortisone injections, would potentially cause damage to the tendons. I mean, one injection, two, might not cause as much of a damage, although there are different studies that cause different things, but that's overall what people tend to go through, and I do as well. As for the PRP injection, I go more with the younger patients that, I'd like to avoid giving cortisone. So those are usually the indications that I give those injections for. You will see me or you'll hear me quote every time studies or studies. I'm a very scientific person. I'm a surgeon. I rely a lot on science and on numbers. And I'd rather use that than saying my cousin did this and he did better.
I'd love to dive a little bit deeper on the injection front, just because it is something so commonly spoken about within the everyday, with the everyday person. So I hear it a lot as an active person when I go to like sports clinic, but then people like my family, my parents' age, are also being told about injections, for a frozen shoulder or achy joints. So I'd love to dive a little bit deeper, just so people get a good education on the different types. So are there any indications or side effects, PRP, for example, and like with the different injections, do they last for forever or like for a short period of time, for a few weeks, a few months, where then a person needs to go and have another injection? Do you mind unpacking it a little bit more so we have a really solid education? So then the next time we go to a sports doctor, we know what we're dealing with.
Absolutely. Yes, it's a very good question and very commonly asked in the clinic. So there's no clear number of how long this injection would last. So it's not a clear, I would say, like months or weeks that it lasts. the purpose of those injections is to reduce the inflammation, to decrease the inflammation around that joint or tendon or ligament. So that's the purpose of this injection. Sometimes inflammation lasts for a long period of time. So the injection might reduce the symptoms for a few weeks or months, and then it just recurs back as the inflammation comes back. But sometimes the period of the inflammation takes weeks or a month or 2 months. So if you give an injection that would last that duration and the inflammation reduces, and then you're good. The symptoms are gone. You don't have any problems. But in people who have recurrent symptoms, let's say someone who has knee osteoarthritis, for example, and then they need an injection now, and then their inflammation improved. And then they live for a year or 2 years without any problems. Then after 2 years, they have this cycle of inflammation again. They might need an injection again. Same thing for the tendons. It might take a long time to improve, and sometimes it takes less time to improve. So it could be within the window of the injection that it improves the inflammation, and then they get better, or sometimes it lasts longer. And one important thing that I always tell the people that I'm giving an injection for is that injection is not a magic. So it's not something that helps everyone. So some people would benefit from it for a very long period of time. Some people benefit from it for a few months, some people for weeks, some people for days, and some people do not even benefit at all. But actually, this spiel is honestly the spiel of my clinic. And I say that probably 4 or 5 times every time someone talks to me. This is the sentence that I always say about injections, because managing expectations is more important than the treatment itself. So if you tell someone you'll get better with this injection, you'll do good and all that, some would have this placebo effect of like, yeah, he told me so I should feel better and I'll feel better. But sometimes it doesn't go that way. And then they would say, he told me I'll get better and it didn't, So it does not always help, and it does not help everyone.
So we've been talking a lot about injuries, and I would love to understand from you how to best prevent injuries.
All right, so that's a great question, and it's an important point to mention. I think a lot of us in Kuwait, especially, and also regionally, I think sports has been much more absorbed in different types of population, not as before. It used to less, and only a certain group of people who used to be involved in sports. Now it's more and more involved over the last decade, and I think it's very important prior to encountering in any of those sports, no matter how significant or labor intensive it is, you should know how to do the factors that reduce those risks of injuries during the involvement of that sport. And that starts off from knowing what muscles and joints are involved in the sport. So let's say we'll take it as an example, one of the most common sports that we do. Let's say soccer here in Kuwait, for example, very common. Is you get the lower limb muscles, mostly the knee, ankle, and hip that are involved mostly in this sport. So prior to being involved in this sport, you got to make sure that the muscles around those joints are actually strong, because what provides the stability of the joint is not only the ligaments around them, which connects the bones together, is also the muscles around them that stabilizes that joint and reduces the risk of injury, whether it's a twisting injury or it's a ligament or a muscle injury. So strengthening those muscles by doing strengthening exercises, whether in the gym or even at house and at home, makes the risk of having injury to those joints much less. That's number one. Number two, what I would say is stretching, not only before exercises, but before and after exercises, because when you go directly to do sports, let's say that requires sprinting, or an upper extremity, let's say in the upper limb, racket sports, whether tennis or paddle, you're using muscles that have not been used in strength for, depends on how often have you been playing. You got to make sure that you stretch out those muscles and tendons. So just briefly, the difference between a tendon and a ligament is that a tendon is at the end of a muscle and attaches to the bone. Is where a connection between the muscle and the bone, while the ligament is a connection between bone and bone, and it provides stability to that joint. So to stretch out and the stretching those tendons would reduce the risk of strains or sprains of those ligaments and tendons that are involved in this sport. So let's say you want to do a racket sport, you want to stretch out the forearm muscles as well as the shoulder muscles, so that when you go into that extreme motion that you use during the sport, you reduce the risk of having injury to that muscle or around the joint. So that's why stretching is extremely important before, which most people know about and do, and then after, which much less people know about or aware about, and they don't even do. So the reason behind doing stretching after workouts is that after you work out, your muscle is going to be heated up and it's loose at that time. But then once you cool down, it shrinks or contracts and becomes a little bit on the stiffer end. So that's why when you stretch out after the workout, you make sure that you maintain the length of that muscle or tendon more or less and reduce the risk of injury in the following workout, and also reduce the risk of having soreness the day after as well. Just putting that in a simple layperson's language, I think that's the best way of mentioning it. Other things that you would do beside those 2 points is nutrition. You got to make sure that you're optimally neutralized with the vitamins, fibers, whatever you need to supply your workout. I'm not a nutritionist, so don't quote me in much of what I say in terms of what to eat and what not. I know in general, but that's not my specialty. But I know for a fact that with studies and evidence of the return to sport, whether it's in the surgical or non-surgical, nutrition definitely helps a lot. I would say those are the main things that come up in my mind that are top things that would reduce the risk of having injuries.
I think that's such an important part. And I love that you brought up nutrition, because we do need protein, amino acids, which are the building blocks of strength. And probably also is like getting enough rest and sleep, right? Because we talk about in my space, and I'm sure, you allude to this too in your space, that's when strength is built. It's, you do your strength training at the gym, or you play your tennis and your paddle and you're moving all these muscles around, and you do the adequate amount of stretching and mobility work. But then when you're sleeping is really when the muscles are repairing, right? And that's when strength is built. So
absolutely an extremely important point that I forgot to mention. Obviously less so it's important for all people, but people who are more involved in multiple sessions, let's say 4 or 5 workouts a week, recovery is an extremely important part that I alluded to. And it's one of the main things that I forgot to mention, is that you have to make sure that you give room for the muscles to recover. And you do, whether it's massage therapies, whether you do mobility training for the muscles, just as not a workout to strengthen or anything, but just to basically rest those muscles, because you have to give them intervals of release. And that's more significant the more the people work out as well.
Because would you agree that we're more prone to injury if we're doing too much?
100%. That's not only my opinion. This is something that is written and it's well known. There is definitely too much of workout. 100%. Once you do that, you would have risk of overstrain. There are so many different injuries that I could point out that would be from overwork. Let's say stress fractures, for example, overuse injuries around the tendons and ligaments. Very commonly seen, especially, from what I see in younger athletes and like baseball pitchers, when they're in their college or even in primary schools, when they do that, sometimes they focus on them. They go progressively very high and fast to the point that it leads to injuries. So that's why rest and recovery is extremely important.
On the topic of too much, so I have a yoga background. I am a certified yoga teacher. I have 3 certifications under my belt, and one of them is yin yoga, which is a type of yoga practice where we hold static poses for a very long time. And the idea is not to just stretch the belly of the muscle, like the hamstring itself, but also to stretch and to what we call breathe into and relax and allow for some space into the ligaments and the tendons. There's a lot of controversy around it. I myself enjoy the kind of psychosomatic aspect of yin yoga, but I've also, in my years of practicing, have experienced some overstretching. I wonder if there was malpractice on my end because I was in my 20s. I had a younger ego. Like it was just like, let's go and let's be more flexible. So my question to you is there such a thing as too much stretching, overstretching the muscle or the ligament or the tendon? And does this impact injury? Have you seen it in your practice? Maybe with yogis, maybe not with yogis, because we're talking about bringing in a stretching practice to prevent injury. But I wonder if you've seen injuries because of stretching.
So it is less common, but definitely seen. So overstretching, what I would say, so putting it simply, just that I was mentioning earlier. So a muscle attaches on a bone and on another bone, whether it passes through one joint or two joints, and it provides the motion. No, simply. So when you stretch out, the muscle has tendons both on the top end and other end, each end that it's connecting to the bone. The stretching mostly happens at the muscle and the musculotendinous junction, where the muscle and tendon junction is. That's where the stretching mostly happens. You can overstretch when, let's say, for example, I'm stiff. I've done martial arts since I was a kid, and I still do that. And when I was 9 years old or 13 years old, I used to, have the full split both always, much easier. But now, as I get into my 30s and so on, you get more stiff. So if I would try to push myself to the limit of stretching to what I'm aiming for and trying to push it to the painful point, then yes, definitely you could have an injury by overstretching that tendon, and you could have a strain over the tendon. So that's what happens when you overstretch. So that's why the cutting point in between them usually is what we call it, is basically the pain. So it's normal to have when you're stretchy, you have this stretchy feeling, but when you reach that painful point, that's when you gotta realize that you have to stop at this point and maybe maintain of that a bit of an uncomfortable position, but not painful position, to prevent that overstretch and pain. But you can never, in my opinion, you can never overstretch, as in, you stretch too often today and you're stretching tomorrow, you're making it too loose. I don't think I don't believe on this as a point.
So what about for like athletic performance and efficiency in the activity that we're doing? So let's say I'm a professional track and field, so I'm a sprinter, and I'm now stretching before the run. Is there such a thing as overdoing it here? I'm not coming to the point of pain, but I'm holding my stretches for a lot longer. Is it maybe causing some instability in the joints where now I'm about to put my body into an insane amount of pressure that it could lead to injury? So is there a point where like you want flexibility and mobility, but there is a point where you can overdo it, where now my efficiency with the movement is compromised, so I'm not as fast, or I'm putting certain joints at risk because they're too stretched, and there's an instability there.
Yeah, so different people have different mobility. So just we can touch base on two different points. So there's the mobility is what the joint is able to move. What's the range of joints motion? And that's variable between a person and a person. So some people like myself, when I go straight on my elbow, it does not go fully straight. I have this like 5 degrees of a bit of a flexion in it. That's my limit of extension, but although I do all sorts of sports and I don't have any problems. And some people go hyper extension, where the elbows, instead of going straight, it goes 10 degrees of curve in the opposite, and even more than that. And those people are hypermobile. So they have hypermobility in their joints. So those people are more prone to have instabilities, as in joint dislocations. So it's always, as in most things in life, things are geared to people individually. So you cannot have one rule that fits for all. So for a person who is a bit or more on the stiffer end, or his joints are a bit stiff, stretching is definitely helpful, as I mentioned, regularly. But in someone who's hypermobile and they know that they have their whole mobility, it's good to do that prior to workout, but you don't need to overstretch, because to have a better stability of the joint, you want to make sure that the tendons around are providing the stability. So if you're already hypermobile, you don't want to stretch out more than what you already have. So it's a bit on the variable end. So unless someone is diagnosed or known for hypermobility or hyperlaxity, then the general rule is to do stretching without having concerns about harm. Otherwise, if someone is in the hypermobility or someone who had an injury before in terms of dislocation on one of their joints, then those patients should have, or people should have, a better geared, stretching kind of a program.
Okay, got it. We talked about soccer because that's a very popular sport here, but I also know that paddle is really gaining popularity in many different cities around the world. Just briefly, because you and I talked about this before, and I know you're a specialist in tennis elbow, and so paddle has a very similar movement, right? Is there any advice you can give to people who are playing paddle? Because I see that these are a lot of people who weren't, like when I look at my friend group, they weren't very active before. So they aren't doing what you've been talking about in terms of like strength training at the gym. And all of a sudden they found this hobby or this activity that they love and they're starting to get committed to it. Also with the social component, and they're going out and doing it more frequently. So that's great for their cardiovascular health and for, overall health that they're getting active. But I wonder if you could maybe share some insight into what they could do in terms of strengthening the muscles just associated with paddle, and also talk about how tennis elbow is not actually the injury of the elbow. It's actually something else. I found pretty interesting when I learned about that from you.
Yeah. So as part of my subspecialty in upper extremity, elbow is one of the common things that we encounter recently, as you mentioned, with the racket sports, more specifically paddle, getting more popular as recently. We've been getting what's called the tennis elbow, which some people know and some don't. Is that it's the tendons that are involved in the forearm. So as I mentioned, so tendon is connected to the elbow of the arm here, and it goes down to the fingers, and that provides wrist extension. Those are the forearm muscles that are attached from the elbow down to the wrist, and that's why when paddle players or tennis players hit on the back, I don't know what you call it. Honestly, I'm not a racket sport player, but backhand head. Yeah, thank you. Sounds simple. So basically, backhand head, they move their wrist, or their wrist is against resistance to keep it stable in this position. So that's why they stress on the tendons over the lateral or the outer aspect of the elbow, and that's what's called tennis elbow. And the opposite is the golfer's elbow, because the golfers hit it from outside to inside. So they use the anterior or the front forearm muscles that are attached from the arm bone here distally, the humerus, and then goes down to the fingers and gives this mobility, basically the flexion or hand closure. So that's why it's not much of the pain of the movement of the elbow that causes those symptoms. It's more the wrist mobility that causes tennis and golfer's elbow problem. Now, going back to your question, with the things to be done to prevent those injuries, unfortunately, some people do get those injuries no matter what they do. But the problem happens is, as I mentioned in the first point, is that when your muscles are weak and you do not do stretching, and you go ahead, I think I wouldn't be unfair to say that most people are just jumping in to play paddle without doing any of the proper strengthening or stretching. So I think it's safe to say most people have not been doing this the correct way. So they've been, stressing on those muscles and tendons without doing the proper preparation for them. You're asking the muscle for too much, and then they get inflammation, and this inflammation gets aggravated. So the things to do is what I mentioned earlier: strengthening and stretching. By stretching the muscles of the forearm that involves the wrist, the same thing in this direction and this direction for the opposite. And when they get an injury, then that's another problem that they need to be assessed, diagnosed, and then deal with it in the modalities that will be discussed by the doctor.
I love learning about how tennis elbow and golfer's elbow is actually more related to wrist strength, forearm strength, and wrist stretching and mobility. And I think that's an important piece for everyone to hear. Yes, you need leg strength, core strength, shoulder strength, maybe bicep and tricep strength if you're doing tennis or paddle. But people forget about this little part of our bodies, right? The wrist and the forearm, and it's actually really important. to consider if they play a rapid sport?
It's actually more stuff. If I would add one more point, they're all connected. So a lot of people would would get some injuries and they don't know what it is. They would say that it's coming elbow, but it might be coming from the shoulder as well, because if your mobility is not proper for hitting a ball, you're strained more the elbow rather than just the shoulder. If your shoulder blade is not stabilized or not strengthened to keep it in place, again, you'll have less mobility around the shoulder. You'll strain the elbow more, the inner part of the elbow. So it's all kind of connected. The same thing goes with the upper shoulder, the core, when twisting. It's the whole body is all connected, and a lot of things are linked to other problems that are not related directly to it.
Well, I'd love to ask you about some of the latest technologies in your field. I know we're all super curious about what's coming up in the field of medicine and surgery, robotics, VR, AI, AR. I think you're involved with robotics from what I gained last time we spoke. I'm not sure, but can you just maybe share with us what you have experience in and what are some of the new things that you see coming into your field?
All right. So I'm going to mention it in general because I'm not involved in robotics yet, but there's robotics is being, it's insane in the past decade how things have been revolutionized when it comes to this, whether VR, AI, and robotics. It's insane. So in the field of orthopedics in general, it's been started off over the past, I would say 5-10 years in total knee replacement. So in joint replacement of the knee with patients who have osteoarthritis. So I don't do those kind of surgeries, but that's when it first started, I would say, in terms of getting so just to explain it briefly, so we get a CT scan of the joint, and then that would be uploaded in a system that would tell the surgeon basically where to put certain pinpoints around the joint to make sure that it gives it the location, the virtual location of those pins in relation to space. So when they get the robot to do the cuts, it basically cuts accurately as pre-planned by the surgeon in a computerized system that incorporates the CT scan with the surgeon's plan of what cuts he wants to make, what alignments he wants to do. So it basically makes things much more accurate. I mean, I'm going to play the devil's advocate, and it has definitely its pros, but definitely it could take a little bit more time, more investigations, more cost on the system. Again, I'm always quoting things based on studies and research, but it gives more accuracy. And I think as time goes, we're going to be able to solve, or they're going to be able to solve more the cost issue, because if you have something that is more costly but gives you more accuracy and reduces the risk of complications or problems later on, and it's definitely something that adds on to the benefit of the patient's outcome and quality of life, then it's definitely going to be modernized. It's what's happening now in different joints and different procedures. Same thing is being done for the spine surgery. So they use a navigation system. So same thing, they upload the CT system. They put it in in a machine, and that tells you where to put the point. And you look at the screen, it tells you, angle your hand. You're there, that's other point. And then it gives you the accuracy of where you drill to make sure you're avoiding the nerves in spine surgery, for example, which I also don't do. I'm not a spine surgeon, but that's one of the things that have been modernized. That's in the past decade or even more actually been utilized. And now VR is being much more, modernized as well. I know of some of the, systems that have been worked at. One of my mentors back in Canada is working on in a VR system that basically is used both for surgery and in educational facilities or ways. So sometimes there is certain surgery, for example, that is publicized or started off by a surgeon in Canada that is that he's trying to teach people around the world, which is not easy to go and travel to each person, or they do, which is classically what's done. In cadaveric courses, we go on, we learn certain techniques that are new. So in this case, he sends you a package. You get the package that has that VR, that has the tools in it, and he would be in Canada. You're in wherever you are. You put the VR, and as if you're getting into the operating theater, and you go through the steps as if you're in the surgery with him, assisting you, and he tells you, no, put in this access here, open the incision here to get, and then you get in as if you're in action mindset of surgery, and he teaches you virtually how to do those steps from like tens of thousands of kilometers away, which revolutionized the educational process in a lot of aspects. As we go now into AI, the different part of this craziness that we're facing in this world as well is a positive craziness, obviously, is that, I just recently read a publication, a study that was published in the Mayo Clinic, that in rheumatology, they're using the database, in most of the, how would I say it, in modern systems or societies, they have computerized systems. They have all the database of the patients, including their age, medical comorbidities, their injuries, their x-rays, the surgeries they had in the filing system and all that. So they've been utilized some steps, an algorithm of how to utilize artificial intelligence and dividing all those charts and getting, whether you need them to be filed in that way or you need to use them for research studies, that you need that data for research. It just, it has some key points to read, even images and all that. It reached a point that it's mind-blowing, and in years you're seeing things that you've never had imagined in a few years. So, I mean, maybe as I'm speaking, there's something that is more modern that I didn't talk about. Obviously, I'm not aware of all the updates, but those are the things that I came to come across in conferences and in research that have been published recently.
I mean, I think it's so incredible, especially this VR piece around how we are now progressing in education spaces. And for people who don't know, VR is virtual reality, where you wear these kinds of like goggles and you can see a virtual reality. And so what you're talking about is people are all around the world and they're watching their so-called professor, or they're being guided by their professor through these goggles, right? But is there VR? Because I think I came across this, but I'm not sure, where there's a surgeon in like Chicago wearing the glasses or some form of virtual reality, and they're performing a surgery to someone in London with the yeah. Can you talk about
that? Yeah, absolutely. So that's done. So it's done. First of all, now it's being done more commonly as conferences, as in live surgery. So that we do that commonly is that, a surgeon does a surgery and it's with cameras, that it's publicized in a conference. But specifically what you're mentioning is that sometimes a surgeon is doing a surgery in a place and getting an opinion, for example, from a surgeon somewhere else, where his goggles are displaying what he's seeing. And in addition, I mean, I think that's even simpler. The more complex is that with this goggle, that's what they've been doing now. And specifically, I know in my field, in shoulder replacement surgery, again, one of my mentors is being is a developer of this a software of basically, while you're in surgery, it incorporates the same CT or CAT scans that were done for that shoulder with the 3D planning that was done before of where to put that shoulder replacement part, the metal piece, and what angle you put this piece, what angle you drill that drill hole. So while you're looking, it tells you, angle here, angle of that. Instead of looking at a screen, you're looking at right in front of you, and you can connect to someone else in another part of the world who could give you some suggestions. And, we've had that. It was actually an interesting thing that was done in one of the conferences I was at last year in the US. It was basically, they were two different surgeons or three different surgeons. They were standing, holding those things in their hand, wearing the goggles, and they're talking individually with another guy in another place, as if they were in an actual theater. It wasn't reality, but it was, VR, basically, not a real patient. But that's also done for real patients as well.
Incredible. So you said you don't do robotics, but I did see when you were giving that talk where we first met a few weeks ago, I did see like 2 incisions that you weren't really cutting the joint, but you had 2 metal.
Yes, that's called arthroscopic. So arthroscopy is a surgery of the joint. So shoulder joint, elbow, knee joint, ankle. Shoulder of a joint that we do it arthroscopically, meaning that we do not open the joint and look at it directly. We put a small opening, a half a centimeter to a centimeter, basically to get in a portal. We get in the camera inside, and then I get another opening that I put the working portal. So the camera would be connected to a monitor. So I look at a screen in front of me. So I look what's inside the joint, and then I use my other opening, a small opening, again, half a centimeter. And then I get the tool that I'm using, whether inserting a screw or passing sutures and everything through those small, now even people call them laser, but I don't like saying laser because there's no such a thing in our specialty as in laser surgery, but it's basically because they call them, I guess, because they're small openings, but that's what arthroscopy means. So there are multiple openings, small, that we work around the joint. Those lenses would look at, the lenses that we look at, screen gives you a up to a 7K resolution inside the joint, and then everything is done. Obviously it's more not, I wouldn't say much of a critical as much as more delicate, because you're working as if you're working inside a box and looking at a screen in front of you. So you're not actually looking at the joint when you're working, you're looking at a screen. So that's basically arthroscopy. That's what, most of our routine work as sports surgeons would do, arthroscopy.
Yeah, so it's like routine for you, and probably the novelty of this has worn off. But for me, at least, where I'm not experienced in the world of surgery, this is a really interesting technology piece, because you're using cameras to get in there to help you navigate the surgery. So this is a technology that I don't know if it's new or if it's been there for decades, but I find that to be such a progressive way to support or
It's interesting that actually, yeah, it's actually I agree. Sometimes you take things for granted because you're not a daily life. But when I first came in to see this in my specialty during residency, it blew my mind of how, we've seen that in also other specialties, general surgery and urology and all that, the obstetric and gynecology. But it started off, I don't know, don't quote me on the dates. I'm not going to mention it, not to mention it incorrectly, but it started off with arthroscopy as, surgeons, decades ago, I'd say at least 40, 50 years ago, or maybe 30 to 50 years ago, is that they put in the camera, they have an opening and they put the camera in and they look at it like this, and they need to diagnose problems in the knee. So they have an opening and they put the camera, obviously, sterility at that time was not as robust as nowadays, but now became more modernized to the point that the cameras are insanely accurate and clear, to the point that we see much better than if I would open and look at the joint, because, we're blowing the joint with water or normal saline, and then we go in as if you're inflating a balloon and you have things inside, and you insert the camera and you look at it as in a world of inside of water, and you fix things, you take things out, and it's basically like a little toy.
Well, cool. So interesting. I love it. Well, before we come to a close, I would love to ask you or pick your brain on maybe any advice you would give to someone who's in a similar field to you, maybe a little bit earlier on in their career journey or even academic journey, or maybe someone who's not in a similar field to you, but they're very high achievers, high performers, and they're in a very tenuous track. Is there any advice, professional advice, you could offer us or offer them?
Okay, so I'll try within my own limited experience in life. I did go through a lot of educational steps, so I think maybe I'll focus more on what I'm better with. I think one of the things that I've seen with different surgeons and different doctors that demarcated how a person is better in what they do is that when you're in trouble, ask for help. Or if you're having difficulties, ask for help. A lot of people have this ego in them that, I did my degree in this place, I did my education on this, I did so many cases or surgeries or hundreds of this, and I don't need to ask anyone's help for anything. I think starting off with my specialty as a surgeon, you should always, first of all, there are so many different cases or scenarios in patients that are different or unique that you might think of a way while someone else might think of it in a different angle. So there's no shame and there's no, you're not degrading yourself by asking someone else's opinion if you're in doubt. Because after all, in my specialty, whatever you're going to do is going to affect someone's life and quality of life, no matter what it is, but it's still going to matter. So I would definitely not fear or be ashamed of asking, whether in surgery. Sometimes we face difficult cases that it's good to have someone else's brains, like in big complex cases. I've seen surgeons, and even in studies, again, I'll quote studies. There was a study that was published in the Spine Surgery Society that if two surgeons, consultant surgeons, work in together in big complex cases, they have less surgical time, less complications in big complex cases. So that's one example. Same thing for asking for opinions about difficult cases. So I've seen surgeons who were, their pride took them more than asking someone, and when they got in, they struggled, and they struggled a lot. And whether we'll deal with patients, whether in surgery, whether after surgery, whether in taking care of those patients, I always think of it in anything in life, whether it's in surgery or outside. You're thinking about your way and angle of life, but whenever you ask someone that you rely on their opinion, obviously, they're looking at it from a different angle. So it's always to get the 2 cents from those people that are experienced, that could give you a good advice about what you're facing, and no matter what you're facing in life. So that's the most important thing that I learned, is when I see those people struggle, and I see the other surgeons who are always, even when I went for my fellowship in Boston, heads of departments and Harvard and whatever, he would be so nice and down to earth to just ask him, what do you think? You trained with this guy. What would you do in this case? What would you do if you'd face that guy, And he just, maybe he'll do what he thinks is right, but at least he would have someone else's opinion and perspective. So that would be the sum of what I would think is important is, don't be ashamed of asking for help in whatever you're facing in problems or difficulties.
I think that's beautiful advice that can be applied to everyone across the board, not just someone who's in your field. So thank you for sharing that. And I also noticed in our conversation, you referred to a mentor. So I guess that's also another manifestation of having someone in your community that you can ask for or look up to for help and advice. Would you agree?
100%. To me, I still have mentors in Canada and in the US that, I don't only take advices about patients or surgeries. I just take advices of life. They've been through all what I've been through for the past 20 years. They've been successful. I find them as mentors to me, even as suggestions in general life activity or life challenges or what we see in daily living.
Amazing. Well, Dr. Naser, thank you so much for being here, for taking an hour out of your schedule to be with us, to explain to us all the different areas of expertise that you have, and to help us be healthier, happier, injury-free humans. So thank you.
Thank you very much for having me, Alia.
Thank you. Thank you for listening. Please share with family and friends that you feel could benefit from this episode, and make sure to hit that subscribe button and leave a rating and review to support the show. Check out the links below for more information about my guests and where to find them. And make sure you're following me on Instagram at wholesome_practice to learn more about what I do. I appreciate you being here, and I'll see you on the next one. This podcast is for educational purposes only and should never replace the advice of your doctor or physician. Always consult a medical professional before making any changes or adding anything new to your diet, lifestyle, or medication protocol.